Good evening, and welcome to The Right Side, the show where we discuss today's issues and news events from an admittedly conservative perspective. I'm Chris Pareja, your host this evening, and I'm joined by Tom Valancourt, who's our guest for this show. Tom, thanks for joining us.
You're welcome.
So tonight we're going to be talking a little bit about the Affordable Health Care Act, as it's officially known. By others, it's known as the Unaffordable Health Care Act, and by yet others, it's Obamacare. So you actually have taken the time to read a significant amount of the legislation.
Yeah.
And actually, I had read 500 pages of one of the first drafts, and I haven't met too many other people who are that masochistic that they would go ahead and tear into it in detail. But why did you get started doing this in the first place?
Well, as Obamacare was unfolding and I was watching how our elected representatives acted and put it forth and how it was passed, I felt that there was a whole lot of freedoms that were about to be lost. So I got involved as far as I wanted to learn about Obamacare, and there was so much information going on, and so much of it was erroneous, that I felt that the only way I could really understand it and find out what it was all about was actually print it out, read as much as I could, but more than read it, because no human being can read this stuff, I wanted a reference manual. When somebody came up to me and said, Obamacare insists that they put chips in everybody's wrist, I'll say, show me in the bill. What section? What title? Where is it involved in the bill? So I could actually, not the bill, the law, excuse me, the law. So I could actually look at the law and either refute or support someone's allegations. But I really wanted a very clear picture of what Obamacare or the Affordable Health Care really meant.
Okay. And so I know that in my house, when I got a certain way in, it was actually illegal for me to discuss the bill anymore because I was doing it at a level that was scaring the children. Were you banned from talking about it in your home as well? Or?
Oh, no. My kids learned a long time ago that I talk about a lot of politics.
Okay.
I've always been interested in what's going on in politics, but it wasn't until I retired that I had the time to get involved as far as really researching everything in politics.
Okay. And so as soon as someone starts using the term Obamacare, people automatically assume that you're a crazy right-winger who hates old people and wants to see the health care bill overturned and old people pushed off of cliffs in wheelchairs, etc. Just to clear the air a little bit, is there anything in the bill that you saw that you did like?
Well, first let me talk about pushing Granny off the cliff. I love that one because it's the Democrats who are taking $500 billion, that's $500 billion out of Medicare to pay for Obamacare.
Right.
It's the Democrats who are doing it. I mean, not one Republican voted for this bill. Not even Olympia Snowe voted for this bill. So it's really that kind of money out of Medicare is really, really going to hurt the older people. But that's done by the Democrats, not the Republicans.
Well, but especially when we have the largest population of seniors moving into the system at the same time that they're taking and I've actually heard $575 billion out of it. That does sound like a recipe for disaster.
It certainly does. And being of the age where I'm on Medicare, when you go out and actually say, I want medical care, so I need to find a doctor, there are many, many doctors today who will not take new Medicare patients.
Right.
They just won't do it because of the problems with Medicare.
Right. Okay. And the non-payment or paying at rates that were previously there.
The rates that are too low, or it takes forever to get paid. And the other thing that's happening that's interesting, because I've talked to some doctors about this, that as a lot of these doctors get older, as the generation ages, a lot of their patients now are shifting from regular insurance to Medicare.
Right.
So that some doctors who are in their late 50s, early 60s, it's getting so 60-70% of their patients are on Medicare, and it's creating huge problems for them.
Right. Well, interesting aside, I was talking to a doctor just in the last couple of weeks, and he had shown me a letter from Medicare. He doesn't accept Medicare, and he actually accepts cash payment from people who come to his office and treats them at a cost that's much lower than Medicare would pay for an equivalent service. And he was told that he needs to report these people as having seen him anyway, or face up to a $2,000 fine per visit for not disclosing to Medicare itself that he's seeing the patient.
I've not heard that, but I do know that when I personally was looking for a physician, and after going through many, I found one, and the first question is, what's your insurance? Medicare. We don't take Medicare patients. So I said, well, I need a physical. I'm willing to pay for it out of my own pocket. How much is it? Oh, no. We can't take money. We can't take money as long as you're insured under Medicare. So basically, you've got a situation where the doctors are really between the proverbial rock and a hard place.
Right.
Yeah.
So back to the question.
Okay.
What do you like about it?
Well, there's a couple things in the ObamaCare or the Affordable Care Act that are good. Number one is that we have to find a way to keep insurance companies from throwing people off the rolls when they're sick. We've got to figure out a way to have insurance follow the people. We've got to figure out a way to get the pre-existing conditions problem solved.
Right.
But most of all, we've got to figure out a way to get the cost down. Now, Affordable Care Act or Obamacare dictates, and the name I like for the Affordable Care Act is healthcare as dictated by Obamacare, because I think dictated is such a good word. It really applies. I mean, you can look in here, and you can see how massive this is.
Right.
And there's just no way. I mean, it's just massive, regulation after regulation.
Well, and that, for people who don't know, and I do know that is the actual bill itself, or the law.
The law, not the
Right.
bill. That's Public Law 111148.
And what people also don't realize is that this was a framework for other laws to be written by the Health and Human Services that are completely outside of constitutional or congressional supervision. These unelected boards are able to create laws as they'd like.
Yeah, what most people don't understand is in the law, and I read this in a Wall Street Journal article, that in this law there is at least 1,536 times that the secretary shall appears.
Right.
Which means the Secretary of HHS, Catherine Sebelius, is really writing the rules and the regulations of the law.
Yes.
There's one that said that where all our medical records are going to be in a database in Washington, D.C.
Yes.
That particular law is that particular rule is 26 pages long, 3 columns per page, number 8 font. There's other rules that came out. Some of them are 644 pages long. It just goes on and on and on.
Right.
But her department are writing the laws, and they have the force of law. And this is what most people don't understand, that because it says the secretary shall, whatever she decides, and she's not elected.
Right.
And the people that work for her are not elected, but what they come up with has the force of law.
Right, and there were actually components that I saw that said that if you were unhappy with the government for the service you received or didn't, you really had no way to address that. They could not be sued or investigated for your complaint. That's what I seem to remember saying.
Well, in general, you can't sue the government. In general, you cannot, unless you're a state. Like 26 states are suing the federal government over Obamacare. But so many of the elected officials or unelected officials can make rules. And for example, it's the IAPB.
IPAB, the
IPAB, yeah.
Independent Payment Advisory Board.
Right. They are neither an agency nor an establishment of the U.S. government. They're completely separate. So who do they report to? Who appoints them? When they make a decision, these decisions that they make, the medical community is going to have to follow.
Right.
But who are they accountable to? If they're not an agency or an establishment of government, who are they accountable to? And that is why my concerns are that this law is not so much about medical care, but it's so much about government controlling your life. Because think about it. If you don't have your health, that's the most important thing.
Right. And this actually paves a way for being able to care for everyone before their first breath until after their last, or up until their last.
Right. Right.
In the context.
Yeah, this law basically, if you read it, if you get into it, and you ask yourself a series of questions about it, the bottom line is, the big question that you ask yourself, is this law purposely designed to fail? Is this setup purposely designed to fail so that you can have the nationalized or single-payer system? Mm-hmm. And if you look at it and you read everything that's involved, it becomes clearly obvious that what they want is the single-payer system.
Right.
And that is a complete and total loss of your freedom to control your health in the way you want. It no longer will have anything to do with what your doctor thinks, what you think, what your family thinks. It's going to be what a government bureaucracy thinks.
So there are many that would argue that single payer is the best way to go, because in doing it, we're the only civilized country in the world that doesn't have a nationalized type of healthcare system where everyone has access to low-cost health insurance. How would you respond to that?
Well, I would respond by single-payer system has basically failed every place it's tried. If you look at, let's just take Canada, our neighbor to the north. They have a single-payer system. I have talked to at least 2 doctors who moved here from Canada, and they will tell you a couple of things. Number one, Canadians who live on the southern border, so they have access to hospitals like in Detroit or Buffalo or Seattle, actually carry medical health plans in this country so they can get medical care.
Right.
That's number one. Number two, you see people from all over the world, they may have a single-payer system, but they come here for medical. They come here for their treatments. There was a big thing in the news where a leader of a province in Canada flew to Miami for heart surgery where he paid for it. Now, a leader of the province is something like a governor of a state. I mean, this is a pretty big shot.
Yeah.
So obviously, how well is the system working up there? And then you can take it even further. In Canada, it is against the law to pay for your own medical care. It's what we would call a felony, to pay for your own medical care. Yet it is going on all the time, and the government knows it's going on, and they're not saying anything because that's the only way people are getting medical care.
Well, I mean, my wife is Canadian, actually, and so my sister-in-law, interestingly enough, is an emergency room nurse. And when you look at things strictly from a cost perspective, like an independent payment advisory board would, what happens is doctors become very expensive. And so to get lower cost care, you use more registered nurses to take care of things that doctors used to take care of. But then when they get to the next level of trying to cut costs even further, things that the registered nurse used to take care of, now the nurse's assistant is taken care of. So by default, in some circumstances, you've got a nurse's assistant doing jobs that the doctor would have done with not necessarily the same skill set, but it becomes a cost factor. And so, and my in-laws do say that if it weren't for the ability to get some kind of supplementary insurance, my father-in-law jokes that, or not jokes, but states that my mother-in-law would have been dead long ago. Because of the weights that are required and everything else. And I think as Americans, we've gotten pretty spoiled by the idea that if we're sick, we can go to the doctor and get it taken care of. They don't realize that a lot of these more nationalistic systems, that the wait could be 3 weeks or 6 weeks or 6 months or longer. And God help you if you don't have the right paperwork in place by the time you get there, because then you get to reset and start over.
Well, you deal with any government agency, it's the same thing. But it's the loss of freedom that bothers me. You know, everything that we have talked about, and just like what you mentioned there, it's the loss of freedom. It's the loss of choice. A good example is some people, for example, when they get older, they sign their living wills that they say they don't want to be force-fed, or they don't want any of these things to keep them alive unnaturally. Other people say, I want to be kept alive as long as I can, do whatever it takes. And that's fine, but that should be the individual's choice. It should be the family's choice. It should not be subject to government approval.
Or government coercion, because in the health care bill, it did talk about mandating that, or insisting heavily that people got end-of-life counseling every couple of years when they got to a certain age.
That's right.
Unless they became ill, and then it would happen more often at the doctor's discretion.
Right.
And so looking at that, that's an invasion of privacy. One of the things that I saw in one of the original drafts that I read was information on expanding the birth interval. So, for example, if the government deems that you're having your children too closely together, someone could show up and counsel you on how to spread them out more effectively.
Right.
And when the government begins to do that, similarly to what they do in China with the one-child policy, I think that we definitely lose a lot of freedom, especially when we're in a country where we have had forced abortions or forced sterilizations in the past. And even was talking to a doctor of obstetrics the other night and said that even in the 90s it was common protocol in California in certain universities to go ahead and deliver the babies of illegal immigrants, as an example, and sterilize them all in one procedure. And that's not something long off in the past. Right. That's in the last 20 years.
Yeah, I haven't heard of that, but again, it's the loss of freedom. It's the loss of control on your life. It's with government taking over more and more and more of your life. But when you look at it, we all complain that the government tells us how many gallons of water our toilet has to have, which is ridiculous on the face of it, but it's meaningless compared to when the government says how many times you can go to the doctor in a year,
right,
or what procedures you must have,
right,
or what procedures you can't have,
right,
and you have to prove that you need this procedure. And worst of all, if the government says to you, I have the money, I want to go get a physical, I'm willing to pay for it, and the doctor says, I can't take your money. I mean, that's absurd on the face of it.
And that's just a physical, not a life-saving treatment.
No, not a life. That's just a routine physical.
So that goes beyond price controls
Right.
to actually, unplanned euthanasia type of a scenario. So, question for you: if this isn't the right kind of a scenario, how would you drive down? Because what it boils down to, I think, affordable health and a lot of the things that government does is about treating the symptoms of the problem as opposed to treating the cause. And the cause is it's just too expensive to provide medical care in the way that we're providing it. How would you reduce medical care?
Well, it's too expensive for several reasons. And everybody will pretty much agree that the quality of the health care in this country is great. It's the cost. So how do you bring down the cost? Well, the present system actually drives up the cost, because what happens is an insurance company will go into a hospital and, let's say, just for example, keep the math simple, it costs $50,000 or $10,000 a day to stay in a hospital. That's what the cost is. And that's what the hospital really has to charge to cover its cost. So along comes an insurance company or the government who says, well, I want a discount. So they take the $50,000 and now the retail price is $100,000. And the insurance company gets a 40% discount. So now it's, well, the actual price is $60,000.
Right.
Okay? So what they've done is they've inflated the price list. So if you're a small business or if you're an individual, you're paying full list.
Right.
Now, what you do is you bring down the price with competition, just like anything. The minute you put competition into something, you bring the price down. You let the insurance companies compete. Mm-hmm. You let doctors compete. That you can see the natural result of, for example, technology. That because of the technology in medicine, more and more doctors now are going into practices like Kaiser or like medical groups so that they have somebody to handle the technology. But the problem today is that technology has created codes. So you go to the doctor and you say to the doctor says to you, well, you should have a colonoscopy. How much does it cost? I don't know. It's code. He can tell you what the code is, right, but he can't tell you how much it cost. So if we had a situation where it was truly the patient and the doctor discussing things, and there was the third-party system, the third-party payer, that's where the problem is.
Okay. So we have about 1 minute left.
Okay.
It would be a quick answer. Do you think that the Supreme Court will uphold the individual mandate being constitutional, or will they deem it unconstitutional?
I have no idea. I have no idea at all. You have 4 conservative, you have 4 liberals, you got Justice Kennedy in the middle. I have no idea what way he's going to go. But what really scares me is one man, the opinion of one man, is going to decide the medical coverage for 300 million plus Americans.
So if your last name was Kennedy and you wore a robe, you would choose?
Personally, I never would have even dreamed of making this a law, but I would choose. The individual mandate has got to be unconstitutional, because if they can tell you you must carry health insurance, they also can tell you, well, because it's better for your health, you should drive a Chevy Volt, and it's better for the country, or you should eat broccoli. If they can control your health, they can control you, and that's the problem. It's a matter of freedom versus government rule.
Well, thank you, Tom, for your opinions, and we will look forward to chatting with you soon on other topics. Appreciate your time.
More than happy to be here.
And at this point, what we'll do is bring in a video from our underwriter, the Conservative Forum.
Constitutional law attorney. They say, oh really, what kind of constitutional law attorney? I say, well, I'm the kind of the true kind. The kind that believe that the Constitution is what the Constitution says and what it was intended to say. Anything beyond that is tyranny and should not be allowed.
So it's come to this, my friends. You ready? The second American Revolution against a ruling class that simply lectures but does not listen or defend the American people. It is government versus the people. Am I right? Yeah. Look at the Electoral College example. Right? A leftist popular challenge to states' rights. You think the founders weren't brilliant people? Did they not know what they were doing by carefully calibrating to get the small states and the big states to come together? Why does Wyoming get 2 senators in California? Actually, I'd rather have Wyoming's 2 senators.
We'd like to thank our sponsors, the Conservative Forum, or our underwriters, the Conservative Forum, for doing all they do to make the show possible. But you may want to learn more about them and the speakers that they bring to Mountain View to espouse conservative values and information. They meet the first Tuesday of each month at 432 Sterling Road. You can learn more at theconservativeforum.com. And upcoming speakers, for example, in June will be Timothy Sandifer from the Pacific Legal Foundation. July is Tom Tancredo, and August is Jack Cashel. Now, in the last few minutes of the show, what I'd like to do is just share with you some very scary information that I've come across over the last couple of weeks. In talking about education, which is another thing that's extremely important to Californians and to people across the country, in addition to things like healthcare, it's another scenario where we're treating symptoms as opposed to treating the true root cause of our plight in turning out uncompetitive and uneducated children into the workforce and unfortunately into the world economy. I learned in the last couple of weeks that actually 45% of the new incoming freshmen coming into one of our local Cal State universities actually require 45% of them to have remediation in math and in English skills. I've talked to business owners who are hiring honor students out of local public schools, and they're upset that an A student can't use the math skills that they've learned to run a simple cash register. We need to start looking at education on a much deeper level and figuring out, as with healthcare, how we can go about solving the problems at the root and getting us back to the fundamentals and the basics of academic types of pursuits, as opposed to just a lot of the social engineering and tolerance building that we're doing with the children, but unleashing them unfairly into an economy that can't accommodate them and is making us less competitive on a business basis. On that note, I'd like to thank you for joining us this evening on The Right Side. I'm your host, Chris Pareja, and I look forward to seeing you again sometime soon.